I mean, it's a quantum leap in the way we are looking at stroke today.
I mean, this is a cutting edge of stroke care.
So for every minute that you delay treatment, there's hundreds and thousands and millions of neurons that are not getting enough oxygen, actually dying. The earlier you treat the patient, the outcomes will be much better for that patient. And sometimes these patients, if you can treat them early enough, they can actually go back home instead of going to a rehab unit. We are the first IDPH approved mobile stroke unit in the state of Illinois. And that tells you there was commitment, there was passion, and everybody was geared to the same thing, trying to save as many stroke patients as they can as quickly as possible. Medicine is changing. The thought of bringing the hospital to the patient never occurred to us 5 years ago, but this is something that, wherever you need rapid treatment, wherever you need treatment where you can actually make a big difference, you rather take the hospital to the patient and initiate the treatment right there, and then you can bring the patient back to the hospital and finish up the rest of the treatment.
Mobile stroke unit is an ambulance that we actually have placed a CAT scan unit into. As everybody knows, if you've had a CAT scan, it's not a light machine. This is a big, circular, heavy device. In the old days, CAT scanners were just so big and the technology was so massive that you could only put it in a room of a hospital. Now we're able to get the images, transport them to a computer, wirelessly send them to the hospital, and then you can make a decision. Our crew will be here 12 hours a day. When that call comes in, they will have a critical care medic, a EMTB medic, a critical care nurse, and then a CT tech. At the same time the local ambulance gets dispatched, we're going to dispatch our mobile stroke unit. So the goal is to either meet the responding EMS vehicle there, or you're going to be there generally 1 to 3 minutes after them. The patient's assessed at their home. We're actually having a board-certified stroke neurologist evaluate the patient via a device called Third Eye Medicine. What that is an encrypted system where there's actually a live feed to our neurologist. If it's determined this looks like a stroke, we bring them into our unit, a CAT scan's performed, and then we make a determination that they need the clot-busting drug, which is called TPA. If that's determined, then we initiate the therapy right there because it's on the ambulance with us. So our goal is to get the ambulance to the patient, do the CAT scan on their doorstep, and initiate the proper therapy within 20 to 30 minutes. We're averaging about a call to TPA in the hospital about an hour and a half. So there's a potential to cut an hour of time off of somebody's care. And think of how many neurons that could save.
The difference could be whether someone can talk or not talk. The difference could be whether someone can understand what you're saying or not understand.
That's massive. I mean, who doesn't want to walk out of a hospital on their own accord? I mean, that's what it's about. That's why we do this.